Hello everyone, welcome back to my channel, Psychology Experiences. Today we're going to explore clinical psychology, what it is, why it matters, and how it helps people improve their mental and emotional well-being. Let's get started. Clinical psychology, understanding the science of mental health introduction. To clinical psychology, clinical psychology is a specialized branch of psychology that focuses on understanding, diagnosing, treating, and preventing mental health disorders. At its core, it combines scientific research with human compassion to help individuals cope with emotional, behavioral, and psychological challenges. Unlike popular portrayals that reduce it to therapy sessions alone, clinical psychology is a broad discipline that includes assessment, diagnosis, intervention, consultation, and research. In today's world, mental health has become a central topic of discussion. Rising stress levels, social pressures, economic uncertainty, and global crises have made psychological well-being a major public concern. Clinical psychology plays a vital role in addressing these issues by offering structured, evidence-based methods to support mental health. From helping someone manage anxiety to supporting individuals with severe mental illness, clinical psychologists work across diverse populations and settings. What makes clinical psychology particularly important is its focus on real-life problems. It is not only about understanding the mind in theory, but also about applying that understanding to improve lives. By blending scientific knowledge with empathy and ethical responsibility, clinical psychology stands as one of the most impactful fields within mental health care. Historical foundations of clinical psychology. The history of clinical psychology reflects humanity's evolving understanding of mental illness. In ancient times, psychological distress was often attributed to supernatural causes, such as evil spirits or divine punishment. Treatments were based on religious rituals, confinement, or physical interventions rather than scientific reasoning. The shift toward a scientific approach began in the late 19th century. Wilhelm Wundt's work in experimental psychology laid the foundation for studying mental processes systematically. Around the same time, Sigmund Freud introduced psychoanalysis, emphasizing unconscious thoughts, childhood experiences, and emotional conflict. Although many of Freud's theories are debated today, his influence shaped early clinical practice. As the field progressed, behaviorism emerged, focusing on observable behavior rather than internal experiences. Later, the humanistic movement emphasized personal growth, free will, and empathy. By the mid-20th century, clinical psychology had evolved into a structured profession, especially after World War II, increased the demand for mental health services. Today, clinical psychology is grounded in evidence-based practice, integrating research, neuroscience, and cultural awareness. Core goals of clinical psychology. Clinical psychology is guided by three primary goals: assessment, treatment, and prevention. These goals form the backbone of professional practice and ensure comprehensive mental health care. Assessment involves understanding an individual's psychological functioning. Clinical psychologists use interviews, observations, and standardized tests to gather information about thoughts, emotions, behaviors, and life experiences. Accurate assessment is essential because it informs diagnosis and treatment planning. Treatment focuses on reducing distress and improving functioning. This may involve psychotherapy, behavioral interventions, or collaboration with medical professionals when medication is required. Treatment is tailored to the individual, taking into account their needs, strengths, and circumstances. Prevention aims to reduce the likelihood of future mental health problems. This includes promoting resilience, teaching coping skills, and addressing risk factors early. Preventive efforts highlight that clinical psychology is not only reactive, but also proactive in supporting mental well-being. Major theoretical approaches in clinical psychology. Clinical psychology draws from multiple theoretical approaches, each offering a unique perspective on mental health. Psychodynamic approach. The psychodynamic approach focuses on unconscious processes and unresolved conflicts. Often rooted in early life experiences, therapy involves exploring emotions, memories, and relationship patterns to gain insight into current difficulties. This approach is especially useful for understanding long-term emotional issues. Cognitive behavioral approach. Cognitive behavioral therapy (CBT) emphasizes the connection between thoughts, emotions, and behaviors. It helps individuals identify and challenge negative thinking patterns and replace them with healthier alternatives. CBT is structured, goal-oriented, and widely supported by research. Humanistic approach. The humanistic approach centers on personal growth, self-awareness, and empathy. Therapists provide a supportive environment that encourages individuals to explore their feelings and values. This approach emphasizes the client's capacity for change and self-direction. Biological approach. The biological approach examines how brain chemistry, genetics, and neurological processes influence mental health. Treatment may involve medication alongside therapy. This perspective is crucial for understanding severe mental disorders. Integrative and eclectic approaches. Many clinical psychologists use integrative approaches, combining techniques from different theories. This flexibility allows for personalized treatment and often leads to better outcomes. Psychological assessment and diagnosis assessment is a cornerstone of clinical psychology. Clinical interviews allow psychologists to gather detailed, personal, and psychological information. Psychological tests, such as personality inventories and intelligence tests, provide standardized data that support diagnosis. Diagnostic systems like the DSM and ICD offer criteria for identifying mental disorders. These systems promote consistency and accuracy in diagnosis, ensuring individuals receive appropriate treatment while minimizing bias. Mental health disorders treated in clinical psychology. Clinical psychologists treat a wide range of mental health conditions. Anxiety disorders involve excessive fear or worry, while mood disorders include depression and bipolar disorder. Personality disorders affect patterns of thinking and behavior, often impacting relationships. Psychotic disorders involve disruptions in perception and reality, and trauma-related disorders result from distressing experiences. Each condition requires a tailored approach, highlighting the importance of individualized care. Psychotherapy and treatment techniques. Psychotherapy is the primary intervention in clinical psychology. Individual therapy offers personalized support, while group therapy provides shared experiences and peer encouragement. Family and couples therapy focus on improving communication and resolving interpersonal conflicts. The choice of therapy depends on the individual's needs, goals, and diagnosis. Asterisk, role and responsibilities of clinical psychologists. Clinical psychologists work in hospitals, private practices, schools, universities, and community centers. Their responsibilities include assessment, therapy, research, and consultation. Ethical practice is central, with confidentiality, informed consent, and professional competence being essential principles. Collaboration with other professionals, such as psychiatrists and social workers, ensures comprehensive care. Clinical psychology across the lifespan. Clinical psychology supports individuals at every stage of life. In childhood and adolescence, psychologists address developmental, emotional, and behavioral challenges. In adulthood, focus often shifts to relationships, work stress, and mental health disorders. In older adulthood, clinical psychologists help individuals cope with aging, loss, and cognitive changes, cultural, social, and ethical considerations. Culture significantly influences how mental health is experienced and expressed. Clinical psychologists must practice cultural competence, respecting diverse beliefs and values. Social factors such as poverty, discrimination, and stigma also affect mental health and access to care. Ethical practice ensures that individuals are treated with dignity, respect, and fairness. Research and evidence-based practice. Research is fundamental to clinical psychology. Evidence-based practice ensures that treatments are supported by scientific findings. By integrating research with clinical expertise, psychologists provide effective and ethical care. Challenges and future directions. Clinical psychology faces challenges such as limited access to care, professional burnout, and persistent stigma. At the same time, the future holds promise through teletherapy, digital tools, and increased mental health awareness. Conclusion. Clinical psychology is a dynamic and essential field dedicated to understanding and improving mental health. By combining science, empathy, and ethical responsibility, it helps individuals navigate psychological challenges and build healthier lives. Thank you for watching. I hope this video helped you understand clinical psychology better. If you found it useful, please like, share, and subscribe to my channel. Don't forget to comment your thoughts below. See you in the next video.